Hi, this is Dr. Nyla, and welcome to week number 3. The material that's covered in this module is pretty vast, so for the purposes of this mini lecture, I would like to review some important skin principles with you. When it comes to a dermatology assessment, please be sure that you are aware of red flags. You should know normal versus abnormal, and also know when it's time to refer to a dermatologist. Things that should be documented with each skin exam is A, B, C, D, E. And as you can see here, I have the stars, which means this is something that is extremely important. This is something that you should expect to see on examinations. You should expect to see this in clinical practice. You should also expect to see this on your boards. So when you are explaining or documenting on any skin lesion, things that should be documented are the asymmetry, how do the borders look, the color, diameter, and is this lesion evolving or is it changing? Any of these things could potentially be a red flag, and it's something that needs to be clearly documented and definitely should not be missed. In addition to these things, another red flag that's very important is there a lesion that will not heal? So anytime you have a patient that comes in with a sore that will not heal, that is something that should be referred to a dermatologist for additional testing. I believe I included this image and the previous images on your supplemental learning for this week. What you're seeing here are things that you should commit to memory. And another thing to remember is that everyone is at risk for skin cancer. So all of your patients should be screened for skin cancer. More images. I highly recommend that you guys find a way to create some type of a cheat sheet or purchase something that lays out all these different skin lesions because it's important and it's a lot to remember, especially as a student. It's also important that you recognize that skin lesions may look slightly different on different skin tones. So make sure that you are a student of how things may present differently based off of the skin tone. Another important thing to remember is to document, document, document. Include the size and the shape of a lesion. Make sure you're using medical terminology. And again, get a cheat sheet. I'm quite sure that you guys see these stars here. And when you see the stars, again, this is something that is huge. So I need you to remember this. As a clinician, you will see a lot of skin problems, but remember that common things occur commonly. Be prepared to be tested on, not just on an exam, not just in clinical practice, but also on your boards. So know how to treat eczema, acne, contact dermatitis, viral infections, fungal infections, bacterial infections, and so forth. Have a plan and also have an alternate plan of how to manage these things. Over your clinical career, you'll see your fair share of human bites. Up to 25% of them will become infected, and they are infected with pathogens of the human flora. The most common pathogens are listed here. And additionally, it is possible to transmit viral pathogens, such as the herpes complex, through a human bite. But what I really want you to remember here is that Augmentin is the first line for non-penicillin allergic adult patients. And you also want to make sure that you address the tetanus vaccination status. Okay. Sometimes imaging will be required, and the reason for that is there can be foreign bodies within these bites. There can be soft tissue injuries. You want to make sure there's no signs of osteomyelitis because, again, these are injuries that can become infected and they may need additional treatment. The assessment of a human bite should include an examination of the joints and any underlying tissue. You want to ensure that the injured site has adequate nerve function. And I got more red flags here. You want to make sure that you look out for compartment syndrome. And those are those 5 P's: pain, pulselessness, pallor, paresthesia, and paralysis. I also want you to review animal bites and insect bites and pay close attention to tick bites. Boards love tick bites, so definitely make sure that you learn about Lyme disease. For Lyme disease, be sure that you know what the risk factors are for developing Lyme disease and what the treatment is for Lyme disease. Patients will ask you about Lyme disease in clinical practice, and I can almost guarantee you that you will see this on your boards. I'm not sure why this is something that's covered so frequently on those types of exams, but I would expect to see questions about how to manage Lyme disease. So this is the end of my mini lecture for this week. There is still a lot of information that you guys have to cover. If you have any questions, you have my contact information. Reach out to me and I will do my best to clarify things for you.